Good morning, everyone. My name is Wickenson Noze. I'm a graduate student at University of Puerto Rico, Riberas campus. Today, I'm going to present my project, which talk about a crosstalk between Transient Receptor Potential Vanilloid 1 and Cannabinoid Receptor 1 within the limbic system, regulates anxiety and depression-like behaviors triggered by stress and rats. Stress is a common life condition which is significantly involved in the maintenance of health or the development of disease. Stressful life event can trigger numerous neuropsychiatric disorders, including anxiety, dementia, and depression. In response to stress, different regulatory mechanisms in the body are activated to allow the organism the ability to adapt to internal or external challenges. Several studies have shown that anxiety and depression disorders are often comorbid each other, resulting estimates of lifetime prevalence of 16 to 50%. 70% of persons with major depression have comorbid lifetime anxiety disorders. 27 to 77% of persons with a principal diagnosis of anxiety disorder develop a lifetime diagnosis of depression. When we face a stressful situation, the hypothalamic pituitary adrenal axis is activated. This activation begins in the paraventricular nucleus of the hypothalamus, causing the release of corticotropin hormone. This hormone binds to its receptors in the anterior pituitary to initiate the secretion of adrenocorticotropic hormone, which in turn binds to its receptors in the adrenal cortex to indirectly stimulate the release of glucocorticoids. The released glucocorticoids bind to the receptors in the brain by negative feedback, causing the inhibition of paraventricular nucleus of the hypothalamus, and also inhibit the anterior pituitary through an increased release of GABA in the parvocellular cell of the paraventricular nucleus to inhibit the excessive release of glucocorticoids. Recent studies have shown that the endocannabinoid system play an important role in stress regulation. The endocannabinoids are neuromodulators of the nervous system, in particular of the mesolimbic system. The endocannabinoid contain various ligands such as anandamida, 2-HG, and various receptors as CB1 and CB2. Anandamida is synthesized in the postsynaptic neuron from glycosophospholipid by the enzyme N-acetyltransferase and NAP phospholipase C and Z to activate retroactively the CB1 and CB2 receptors in the postsynaptic neuron. On the other hand, 2-HG is synthesized from glycosophospholipid by the enzyme phospholipase C and acetylglycerol lipase to activate retroactively the CB1 and CB2 receptors in the postsynaptic neuron. This figure shows the relationship of the effect of stress on the endocannabinoid system in the brain. In a situation of stress, the paraventricular nucleus of the hypothalamus is activated. That allows the secretion of corticotropin release hormone, which in turn favors the synthesis of FAR. The elevation of FAR decreases anandamide level, leading to the activation of the anterior pituitary to release the adrenocorticotropin hormone. In addition, the adrenocorticotropin hormone activates the adrenal gland to release glucocorticoid to the central nervous system. The glucocorticoids, through negative feedback, require 2-HG from the hippocampus and MPFC to inhibit the paraventricular nucleus of the hypothalamus and adrenocorticotropin hormone in the anterior pituitary to inhibit the hypothalamic pituitary adrenal axis HPA. The first objective of this project is to characterize how TRPV1 receptors within the brain mediate anxiety and depression-like behaviors through CB1 receptors following exposure to stress. The second objective is to examine the change and TRPV1 and CB1 receptors expression level within the MPFC, amygdala, hippocampus in response to stress, depression, and anxiety-like behaviors. We hypothesize that the blockade of FA with the URB597 and the activation of TRPV1 with Alvenol will decrease anxiety and depression-like behaviors following exposure to stress. Secondly, we hypothesize that the blockade of FA and the activation of TRPV1 will increase CB1 receptors expression and will decrease TRPV1 expression within the MPFC, amygdala, and hippocampus compared to animal in the control group. For this project, we will use male Sprague dairy rats. As drug, we will use FA inhibitor URB597 at 0.2 mg per kilogram intraperitoneal, and we will use a TRPV1 agonist or Alvenol at 0.3, 0.5 mg per kilogram intraperitoneal, and we will use the MSO PBS as vehicle. For the preliminary result, rats were habituated for 3 consecutive days with saline. The next day, animals were divided into groups. One group received an acute exposure of URB597 at 0.1 mg per kilogram intraperitoneal prior to 6 minutes for swim test. Another group received a repeated exposure of the drug for 4 days prior to the first swim test. A 15-minute pretest session was performed to habituate the animal 24 hours before the test. During the first swim test, the total time spent in floating and swimming were measured, and enemy software was used to analyze the behaviors. This figure shows that an acute exposure of URB597 tends to decrease the time spent in floating and tend to increase the time spent in swimming. This figure shows that the repeat exposure of URB597 significantly decreased the time spent in floating and significantly increased the time spent in swimming. The acute exposure of URB597 tends to increase the CB1 receptor expression in the MPFC and provoke no change in TRPV1 receptor expression. In conclusion, the blockade of FA decreased depression-like behaviors following repeated treatment of the drug. In contrast, no effect was found at a single dose. In addition, the blockade of FA tends to increase CB1 receptors expression within the MPFC. These findings suggest that URB597 might be an innovative therapeutic approach for treating depression-like behaviors. Thank you so much. Now, I'm ready to respond to your question.